Hi there, it's Dr. Lisa and Dr. Britt.
Hi guys.
And we're from Errol Street Chiropractic in North Melbourne. And today we're chatting about lower back pain, and in particular, where could your lower back pain be coming from? Now, for people that are suffering quite a bit with their lower back, and perhaps you're sick of taking medication and you just want some answers, well, hopefully today we'll go through three very common areas that we see are causing people a lot of problems with their lower back. So stick around because we're going to go through those three things and then hopefully give you some direction of where you might get some answers too.
Exactly. Yeah.
Okay, and I'll let you know why I'm holding my shoe
All
too.
right.
So, one of the areas a lot of people are quite worried and concerned about when they come to us with lower back pain is what, Britt?
Is whether they are suffering from a disc issue, whether their back is coming from a disc bulge or a disc issue, and that's probably their biggest worry when they come in suffering, especially if they're coming in from quite severe lower back pain as well.
And these are people that generally haven't necessarily had a car accident or a fall or a sporting injury, and they may have just picked something up awkwardly or picked up a child or put their shoes on and they've just got this pain.
Yeah, it's just
they
hit them all of a sudden.
And then they may have even had this pain for quite a while, perhaps medicating, perhaps trying to sort it out themselves. So a big worry is it a disc issue? So in the office we can't 100% tell people that you have a disc issue because you do need to get an MRI.
We get you to go out and do further imaging such as an MRI.
But there are certain symptoms that generally will tend to indicate a disc involvement. So what are they?
So normally if a disc is involved with your lower back pain, you will be having quite intense lower back pain, but it will be associated with some nerve involvement. So whether it's some of that pins and needles down the leg, so it can be down the front of the thigh, down the back of the leg. Sometimes it can be a bit of numbness, so just that loss of feeling, and it's usually around like the inner or the outside of the thigh as well, but sometimes it can travel down and you can get a bit of that numbness or that tingling into your toes. And also just some muscle weakness as well. So there tends to be that associated nerve involvement if a disc is involved with your pain.
Yeah, definitely. So watch out for those sort of symptoms. It's not 100% conclusive, but they're really strong indicators.
Point you in a direction.
And it tends to just be there all the time. So not really giving you much of a rest from that pain. So disc issues are, we do see them quite a bit. We see them in really all ages. But the thing is, so once you do know that it's a disc issue, then what do you do about it?
Well, what has caused that disc issue to occur as well?
What's caused it? So, apart from those injuries where you've had a big fall and you've just had that trauma to the back, what we tend to see with a lot of disc issues is a couple of things. So we tend to see problems with the alignment of the spine, and we seem to also find that it's associated with a lack of or distorted function. So it's not moving as well as it should, that spine. Okay.
And that's usually something that's been building over time from poor posture, just overuse with exercise, sitting too long, just a numerous amount of different things that we do in our day-to-day
but
lives.
Also a history of having had accidents in the past and that they hadn't really been dealt with properly. So people will tend to come in down the track and so the discs will then get stressed because the spine, if it's not sitting where it should be sitting, so if the spinal alignment is out, so we should be standing, or our spine should be nice and straight when we're looking at you front to back. So, and then when we're looking at you on the side, that lumbar
should have those distinct curves.
Should be forward. So if we've got distortions in that function and alignment, then that's going to, and through poor sitting or old injuries, then that's going to be putting pressure on your discs as well as your joints and other structures, which could also be adding to that pain. So over time, if we don't deal with this, then the discs are definitely going to get irritated, and that could lead to that nerve pain down the leg. But we tend to see this kind of issue that then leads to the disc issue, and that also then leads to disc degeneration
and spinal degeneration
and
as
spinal,
well.
And
if your spine's under a little load over a period of time, then it is going to increase the rate at which you age, and that then in turn creates a lot of those problems that are harder to fix once that degeneration starts to occur as well.
So spinal degeneration is spinal decay. It's the same sort of thing. So that's why I've got my shoe, because it's important for you to understand what happens when your spine is not sitting or moving the way it should. That, say you've got a shoe and we're walking along with this lovely level shoe. Now, if I, for example, were to put more pressure on the outside of my right shoe, then if I do that for an hour or two, is that going to cause any trouble to my... It's not going to really change.
Not for an hour or two.
No, it's not actually going to change anything on that structure of my shoe on the outside. But if I walk on the outside of that shoe now for 2 months, if I'm putting more pressure on the outside of one side, I'm not even, I'm not moving properly, is that going to cause uneven wear on my shoe?
I would say so.
Yeah, that's right, of course, because you're putting more pressure. Now, really, this is what happens to the spine. It is actually so simple that people just don't think about it, is that if your alignment's not right, if you're off to one side or you're too forward or back, everything's going to get stressed.
And it's amazing when we see patients' x-rays as well, how many patients we see with that bit of a tilt happening through their hips. It's really common that one hip's always just a little bit higher than the other as well, and that comes, it puts then a lot of pressure through the lower back because you're not evenly weight bearing. Your
foundations are off. So if you've got one leg shorter than the other, we might see that in about 10 to 15% of our people. Then that is really going to load up one side of that spine and create all sorts of distortions and compensations.
And even that posture when you're standing where you just start to tilt and put pressure over to one side of your body when you've been on your feet for a period of time, that over time as well creates a lot of stress through our lower back as well. So those things like our poor postures, our poor daily habits around our spinal health, not exercising. Yes, exercise is a really big one.
And past traumas. These are the things that can lead to these distortions of posture or structure and function in our spine. So we're just going to kind of talk a little bit about weakness.
So that's another thing that we see can be a causation of lower back pain is muscle weakness. And predominantly when we talk about weakness with lower back pain, we really are looking at that core. We tend to find that people with chronic lower back pain, or even patients who maybe haven't had major lower back pain issues, but all of a sudden they're starting to get quite acute episodes, tend to see a lot of weakness in that core, and that core is really important for that support and stabilization of our lower back, because it works hand in hand with our lower back muscles. And we've done quite a few videos on core, and so if you're not familiar with it, make sure you go and have a look at some of our previous videos. We've done them in the last few weeks as well.
So we've got, actually last week we did one on core strengthening exercises, and then we did some stretches the week before for the lower back. And even I think we've got one just how to do basic core activation as well. So that's a really important one, is that weakness, because when we are weak through our core, it kind of makes us kind of want to roll and lean forward, because we lose that supporting mechanism to hold us nice and upright. But then we also can have that other side of the scale where we've got a lot of tightness, and that can actually cause lower back pain. So if we've got like tight hamstrings, or our glutes are too tight, or our other muscles that surround our glutes, our piriformis muscles really tight, that actually then can predispose you to some lower back pain, because you've got that tug of war happening through your spine. It's pulling on that pelvis. So there's a lot there, isn't there?
There's a lot that goes into lower back pain.
We're trying to keep it brief. But so if we look at it, then problems that can be causing your lower back issues could be coming from the discs, it could be coming from the joints that aren't sitting right, it could be coming from your alignment of your spine, if your spine's not sitting in the way that it should when we're looking at your front and on the side, and it could be coming from weak muscles. And in fact, I reckon generally we see all of these issues
all run hand in
together.
hand,
But it is important to obviously be really mindful of those disc symptoms that we said. Then, you really do need to get that area of that lower back assessed more closely, perhaps with the scan. But guys, generally, start looking at your postures, start looking at your activities daily. Are you getting up often? Are you doing your core exercises? And some stretches, you can definitely refer back to some more videos. But if you're finding that that's helping, great. If you're finding that these things are not helping, then you really do need to go and get that spine assessed if that pain just keeps going. So, whether it is your chiropractor, whether it's your physio, osteo, whoever you normally see, then, do go get that addressed, because it is really important that that spine is working well and it's healthy.
And doing something about it sooner rather than later gives you a better chance of, getting over it quicker and just, not losing any of your quality of life.
Exactly.
Yeah.
Who wants to be in pain? It's not much fun, really. So, hopefully what we've gone through today helps, gives you a little bit more understanding about what can cause those lower back issues. And if you guys have any questions or comments, then comment below or send us a private message if you would prefer that we answer something privately. Yeah. We are here to help.
We are.
All right, guys. So thank you. Thanks for listening today.
Guys.
Thanks, Britt.
Thanks, Lisa.
We'll see you all next time.
See you.
Bye.
Bye.